Disclaimer: the contents of Studio 151 podcasts and the TU Communication Disorders Connection podcast do not represent the views and beliefs of the University of Tulsa and the Mary Kay Chapman Center. Hello, welcome back to the TU Communication Disorders Connection podcast. This is your host, Alyssa Hall, and today I'm joined in our new studio by two special guests. Our first guest today is Bella Nolly. Bella is another second-year graduate student at the University of Tulsa, and she's going to be joining us for this conversation today. Bella, it's nice to have you here.
Thanks, Alyssa.
Our second guest today is Donah Leavell, who is a mom of one of our clients here at the Mary Kay Chapman Center. Interestingly, one of my clients here at the Mary Kay Chapman Center for the past year. Donna, it's great to have you here today.
Thanks for having me.
With that, I'm going to pass it over to Bella to ask Donna some questions.
So, could you tell us a little bit about Liam's diagnosis?
So he has a genetic condition called 22q 11.2 Partial Deletion Disorder. It's also known as DiGeorge syndrome. But it's a genetic disorder that causes a small piece of the chromosome, the 22nd chromosome, to be missing or deleted. And it leads to a whole host of symptoms that can affect pretty much the entire body system. While it is considered genetic, Liam's, ironically enough, is actually what they called a spontaneous deletion. So they don't know what caused it. It wasn't something that I or my husband carry. It was just something that spontaneously happened.
So when did you start to notice differences in his communication?
Actually, we didn't get the diagnosis at birth. He was always a really happy baby. He would coo and smile, and he was always making noises. And he really seemed to understand what people were saying. He loved to hear everybody's voices. He liked to be sang to and talked to. I think he said his first word when he was about 7 months old,
Wow.
which was mama, which was awesome. I worked really hard on that.
That's sweet.
And I have a video, well, it's a live picture of him saying, "Oh yeah," just like the Kool-Aid Man when he was about 7 months old. It was the first time I had given him Jell-O. But he was hospitalized when he was 9 months old due to, well, the chronic sickness that he dealt with, chronic pneumonia. He had been sick for quite a while prior to that, but he wasn't responding to antibiotics, so it just kept getting worse, and he wound up hospitalized. It was a really difficult time. He was in the hospital for 2 weeks. They had told us when he was admitted to prepare for the worst. Like, it did not look very good. He wasn't himself. He was not playful and happy. It was just really, really stressful. And then all of a sudden, everything started working how it should. We had switched him to thickened liquids because he had dysphagia. And at 2 weeks, he was released from the hospital. But following that, we went through a really big regression. Like, he did still babble and coo, but the words like mama, anything else, he could say hey, he could say nana, those things, they all just went away. It just was gone.
Yeah.
We wanted to look into that. So his pulmonologist, he sent us to ENT. Liam did have to undergo several ENT surgeries. They've not actually found an underlying reason as to why the speech went away. At this time, he's in a really good place right now, so we're really happy with that.
When was the moment when you decided to pursue speech therapy for Liam?
So after the major hospital stay, he was 9 months when that happened. We were desperately searching for a new pediatrician. The one we had just did not listen to any of my concerns. He just kept saying, "Oh, it's new mom concerns, you're just stressed out." But again, that was at the precipice of COVID, so a lot of physicians' offices were not taking new patients. We had actually put him on Sooner Care. But unfortunately, a lot of pediatricians were not accepting new Sooner Care patients. That was something that I had never realized as someone who was privileged enough to have private insurance my entire life. I never knew the struggles of someone who had Sooner Care or any type of medical assistance needs. So that was a huge struggle. Mm-hmm. And I called, no joke, 50 different pediatricians' offices. And I reached out to one. A friend of mine was like, just call them and see if you can explain the situation and if they'll help you. I probably sounded like a blubbering mess, but the receptionist was super sweet, and she was like, we're not taking new patients or new Sooner Care patients. And she said, however, I feel like I can help you. Let me talk to the doctors and see if we can figure something out to help you. And I was like, okay. And she was like, hey, so while we're not taking new Sooner Care patients, our doctors would really like to meet with you. They would like to see Liam and see if there's something that they can do for you. Very first appointment with the new pediatrician, she was so sweet, very thorough. We had more than just speech concerns. There was a lot going on. And she was like, hey, I think there's something else going on here. I would really like to send you for genetic testing, and I'd really like to get him in to see speech therapy because if he was talking, but he's no longer talking, that's really concerning. When she recommended that, she sent in the referral, and we were like, yes, absolutely. I think he was about 1.5 years when we were finally able to get into the speech therapy. I think he was almost 2 years old the next time he said mama. And that seems to be the one word that has continued, like carried through, which is like really special to me. Yeah. But it was very hoarse. In one of his surgeries, his ENT surgeon actually told me that it looked like the vocal cord had some damage to it. They did determine that because he had dysphagia that went undiagnosed for so long, that probably caused it. And we're hopeful that it'll heal over time. But the damage that's there is not damage that would keep you from speaking.
Yeah.
So it would just make it sound hoarse. So I don't know how true this is, but the ENT surgeon said Emma Stone actually has the same vocal cord damage.
She has a raspy voice.
Yeah. So when he told me that, I was like, oh, my son could sound like Emma Stone. I like that. Oh. Okay. She talks very well. Mm-hmm. So I wasn't super concerned about it.
So I know that some of the stuff Liam works on in therapy is working on a communication device. When did that sort of first come about?
We started our speech therapy journey at St. Francis, and one of the very first things we did was picture recognition and just seeing was he able to recognize certain things, and he could point to answer. So like, do you want the cow or the horse? And he would point. That was our first like very crude communication device. Eventually we went to we laminated the sheet and put Velcro so he could stick the word up there. We're also incorporating like sign language. So at that point I was like, we need to move past this little chart that has like 6 answers on it. But he's always seemed to understand more. Even when he was a baby, like the nurses and the NICU were like, I really feel like he's judging me. Like they would say something that was worth judgment and he would look at them like he was judging them. And and he's, you've met him, Melissa, so
he for sure does that now.
He's very judgy. I love it. He gets the same look that my grandma would get when us kids would do something ornery, and she would just look at us in the most judgmental, loving old lady way. That's exactly Liam got it honest. I feel like as far as language goes, he understands a lot. When we moved into the sign language, he picked it up really fast, faster than I could pick it up. So I was learning with him. And he would get a little frustrated if people weren't listening to him. So he developed this habit of hitting people. And he's a really easygoing kid. We don't have a lot of behavioral issues from him. So I started observing more, and I was like, oh, they're not reacting to the cues that we've taught him to give. So now he's hitting. And so anyway, when he was learning sign language and he was picking it up faster than I could, he would get frustrated, and he would start that, if he didn't know the sign for it, he would just make up a sign. He would be signing something. I'm like, that looks like a legit sign, but we've never learned that. I have no idea what that is.
Yeah.
On the flip side of that, once he got really comfortable with it, with us understanding, he got very lazy. And while I understood what he wanted, and Nana understood what he wanted, and Dad understood or could have me translate, other people didn't understand. So our speech therapist actually brought it, and she was like, hey, I want to try this communication device. And at first I was a little hesitant because I was like, I really don't want to stop his progress on sign language because I had been reading so much about it and the benefits of it, and so I was really excited that he was learning it. But we had kind of stalled out. He loses interest in things pretty fast. And so I was like, well, anything to get him heard. And so we started with simple things like yes and no or up and down. He picks things up really fast. So she was really excited about that. He's so expressive. His facial expressions, you can read him. And while I can work with him and I can learn sign language with him and our family can learn sign language to communicate, that doesn't guarantee that everyone in this world is going to be able to communicate because sign language is just not taught broadly. Really unfortunate. At that moment I was like, yes, we're going to keep pushing this device. And when he started here at TU, we were able to get a full hour, which was amazing. The difference in St. Francis therapy and here was that he had time to get comfortable in the sessions and really start engaging. So when we started going to school full days and we were doing St. Francis speech therapy and coming to TU, we were getting a lot more speech. And he started enjoying school more. So at St. Francis, we had started the paperwork to get a communication device. He would not participate there. We would go, he'd be fine in the waiting room. As soon as they would come out, he would just refuse to go back there. He didn't want to go through the door. He would scream, and that was just not normal for him. So we thought, maybe he's sick, but it kept happening every time we would go. At one point, I think this was like 3 months into the not participating, they were like, yeah, so we just don't think this is the right fit for him anymore. I think he's graduated us, and we're not benefiting him or you in any way. And I was like, okay, fair enough. We were still coming here to TU, and he was participating really great. So we just kind of pushed harder into that, and I brought up the communication device with Rhonda. While the process was still really confusing, we got more answers and we got progress, and I was kept up to date. Like when we would do his progress report, you guys would tell me like these are the goals that we set, and we would go over those. And even though it was a really slow process, I felt a lot better about it because I was constantly kept up to date on where we were. Mm-hmm. And then this year, 4 summer sessions started. She brought me the paperwork to pick the device, and I knew I wanted the LAMP program because that's what he had been working with and was so good at. And we ended up picking, I don't know what it's called, but it's the Mini.
Yeah, he has a Via Pro Mini.
Yes.
And so the one that he had been using in therapy for like the past year here was a regular Via Pro. Yeah. So it's the same system, just in a smaller format.
Yeah.
And that was I remember you brought him in and we did a device trial.
Yes.
And you had mentioned one of the things that was important to you was size.
Yeah.
Because he's kind of a small kid.
He's tiny.
And the one we had been using, carrying it around is just a lot.
Yes.
And so we knew almost immediately, we were like, yeah, this is going to be the fit.
That was, and it's funny that you bring up the trial device. When we were allowed to bring one of y'all's devices home with us, and he was so excited. He was so excited to show his dad and his sister and use it. And the amount of independence that it gave him at home and just out in general was phenomenal. We had stopped somewhere. He had been asking for applesauce, using his device, saying, I want applesauce. And I'm like, okay, well, we don't have any, so we got to go to the store and get some. And so I was like, okay, we're going to the store. And it was like 5 things that we needed. And I was like, we need this, 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 and this. And don't let me forget that we need applesauce. So remind Mommy when we get in the store that we need applesauce. Super excited. Big smile on his face, had the device in his hand, and we're walking through the store, and he would remind me of things, the 5 things that were on my list, and he would say, milk. And I'm like, oh yeah, we do need milk, because I have a squirrel brain, and my small child has already picked up on that, and he's like, I can manage this. So he was reminding me of things that were on the list, and if he saw something he wanted, he would say want, and he would find the word for it in the device. And at school, they were like, we're working on manners, so when he says he wants something, he has to say please or we won't give it to him. Mm-hmm. And I'm like, oh, I love that. Because you don't think about teaching a nonverbal child manners.
Yeah.
Just because he's nonverbal does not mean he's not capable. And I loved that because even though I didn't think that he wasn't capable, it just wasn't something that I was prioritizing because of all of the other medical things. When I look at my son, I see, this fragile baby that was so sick and struggled and fought for this life that he has, whereas his teachers, they didn't go through all that with him. And so they're very much like, no, we expect him to learn please and thank you, and we expect him to learn X amount of words and really focus in school. And I loved that because that was what we both needed to really help push that communication more. But in the car, so I was like, oh, we have to use our manners. And so he was like, applesauce, please. And I was like, well, what do we want to do with our applesauce? Because when we were doing signs, he knew how to sign, open. He could do all that. So we looked for open, and he was so excited. And he typed in open applesauce, please. And I was like, okay. And I opened it, and he pushed the thank you button. And I was like, oh, yay. I didn't even have to remind him. It was fun to watch because it was a holiday. So we did have other family members in town, and we were all at Nana's house, and he would interact with his cousins and use the device to say something to them. He tends to act more like his dad and is very much an introvert and not involve himself in everything. He's very much a mama's boy and a Nana's boy and a daddy's boy. Like, we're his clique. And it was interesting because he interacted with everyone. But he is very clumsy. And it was a very large device. And his little feet, he's still in orthotic devices, and so he's very clumsy. He gets really tired very easily with walking. So he ended up falling, walking on flat ground. I'm like, how did that even happen? The communication device that was on loan to us from TU shattered.
Oh.
And Liam was going, and like pointing at it, like, fix it. And I'm like, I can't fix that. And then I was like, oh my goodness. And they're closed for the holidays. I can't even call them and tell them what happened. How do I tell them I broke this? Like, this is the first time we've ever been able to borrow a device and it's broken within days. Kids, they're messy. So we really thought about all of that when we were picking the Mini, and it has been great. His teachers are even happy with it. I don't think they even knew there was a Mini available.
Mm-hmm.
So when he got the device, he strolled in there with it and was showing them, and they were like, oh, it's Mini. It's the perfect size for Liam. Like, it is. He's so small, and it just fits him so well. And it was really exciting. The first thing that he did was go to Cars, because
Yes.
in therapy, we'd programmed his favorite Disney Cars characters, and he was like, and like waving at it, like, where are they?
Mm-hmm.
I'm like, we have to program those in. I was like, we can. And then I realized we asked for it to not be connected to the internet and not be able to play games. I wanted it to be just for communication.
Yes.
So I was like, oh, how are we gonna get the picture? So I'm like, okay, go get your toy cars. And so we were adding the cars that he has and taking pictures, like physical pictures of them.
Sometimes what we do with our devices here that aren't connected to the internet is just like look it up on another phone and then take a picture of the phone.
That's exactly what we did. So it's funny because some of them are really pixelated.
Yes. And
Yep.
on his car page now, well, it's like half the page is filled up with
Yes.
Disney cars and just toy cars that we have in therapy, and I'm sure stuff you have at home.
Yes.
But some of them are like a stock photo, and some of them are like the blurriest like picture, because whenever he requests us to add something on there, he wants to take the picture.
Yes.
Or
Yes.
he'll like tap on the page and he'll open the edit, and then we'll type in the name, and then he will grab it back
And take the picture.
and be so methodical, like lining it up and hitting the button and zooming in, and then he's like, once he's got it perfect, he'll hand it back.
Yeah, that's exactly what he does at home. He got really into photography this summer on his other device, like taking pictures of family members and the chickens and all the things. And if he takes a picture of you, it's usually like your chin.
Yes.
Not a very flattering photographer.
He has a vision
Yes.
that I don't quite understand.
He's been obsessed with cars, like Disney cars, for so long. He gets a new Cars toy every time he's in the hospital or having a procedure done. Now that he has the device, he'll tell me which one he wants next. He had requested Miss Fritter, the bus from Cars.
Yes. The first couple of times we've been back this fall, he just will not stop talking about Miss Fritter.
Yes.
And I'm like, where did this come from? Because she wasn't on the old device.
Yeah. And Rip Klutchkonsky is currently his favorite. Yeah.
Rip Klutchkonsky was one that we found a toy in
Yeah.
our therapy room, and I had to look up which car it was, and I was like, hopefully it'll be like an easy name I can pronounce. It was not.
Yeah.
And so that is probably the most used
Yeah. Oh, yeah.
thing on the device in our room, at least.
He does not have that car at home, and so that's like on his list. Like he wants that one, so that'll be the next one he gets, I'm sure. And he's so, even in just the short amount of time we've had it, because we're only in like we're in October. That's like less than 3 months because it was like mid-August. Wow.
That is a crazy thought, because he uses it
All the time.
and you teach him something and he knows it like that.
Once. Yeah.
Mhm.
He does it like you find the word for him and then it has like the preview where it highlights just that word. He does that once and then it's like
He's got it.
he knows it. Yeah.
And my favorite thing about like the way he uses his devices, he's so curious about the language that he doesn't know yet. He still has his ones he reverts to, but he's so just wanting to explore the different pages. And sometimes that's what we'll do in therapy. He'll just click open a new one and kind of look for a while
That's awesome.
at the pictures.
Yeah. Yesterday, actually, I was picking him up from school, and one of his friends comes out. He was pointing at him, and then he pointed to his device, and I didn't quite understand. He like went to it. He actually found the word finder, like clicked on word finder and handed it to me to spell his friend's name. So I type in his friend's name and thinking, I don't know, we'll try it. And I'm like, oh, it's not in here. And I handed it back to him, and he clicked on the edit button. He went to the family page in the device and went to where all our family pictures are and hit edit and handed it back to me to program his friend in. I'm like, that is amazing that he knows how to do that. And so I said, oh, no, we can't add it. And I said, oh, let me show you how to get to it. Find your letters page where you do your alphabet and your numbers, the keyboard. And he pulled it right up, and I said, okay, look, we can type his name in. And I spelled it for him. I said, type in this letter. And he pushed the bar at the top, and it read off his name, his friend's name. And Liam's face just lit up. He was so excited, and he ran over to his friend, and he showed him, and his friend's face lit up. They were both so excited. He said, good job, Liam. And it was so cute and just so wholesome. And that is what we were looking for when we started the speech journey, without even being able to articulate ourselves what we were wanting. I just wanted him to have the capability to use the words and to interact with other people and have those friendships and all those things. And it's been amazing. And we're just 3 months in.
I'm really excited to see where it goes. All right, with that, I think we're going to wrap up our discussion. It was so special to hear a little bit more about Liam's story, especially as someone who gets to see him every week and gets to see some of that progress. So, Donna, thank you for joining me in the studio today.
Thank you for having me, and thank you for all that you guys do for not just Liam, but all the kids that come through the Mary Kay Chapman Center. Like, just seeing his progress, I know that you guys are doing amazing things with all of the kids that you interact with. So, thank you.
For everyone who listened along today, I want to thank you for listening in, and we hope you will catch us on the next episode. For further information or podcast ideas you'd like to share with us, please reach out at 918-631-2504. And remember, communication is not just about words, it's about understanding, empathy, and connection. Until next time, keep listening, keep learning, and keep communicating.